I'm briefly going to outline for you some of the treatment that we need to consider. And one of the most important things is having an experienced multidisciplinary team with doctor, nurse, dietitian at a one-stop clinic. That may also additionally have people who are there to support from the charity Verity, but if not, we should be recommending people access Verity because there's a lot of self-help group and finding people who are dealing with the same things, which can be really helpful. I'm briefly going to go through the international evidence-based guidance on the management of PCOS before talking about the NICE guidance. So just to note, the letters in the brackets at the end of these statements tell you whether it's evidence-based recommendation, whether it's a clinical consensus-based recommendation, or whether it's something practical that we would encourage as a clinical practice point, but might not have the evidence directly related to PCOS. So we're talking about lifestyle interventions, diet, exercise, and behavioural strategies being recommended in order to support weight loss and in decreasing central obesity and decreasing insulin resistance. So healthy eating, regular physical activity should be encouraged in order to try and maintain healthy weight and optimize the hormonal outcomes and quality of life. So we are looking practically at trying to aim for achievable weight loss of 5 to 10% and using a patient-centered approach, which we should be using anyway, but it is particularly relevant for this client group. So the behavioural interventions, these are behavioural techniques or strategies that have a good evidence base generally for supporting behaviour change and in long-term conditions, but the evidence base may not necessarily be in PCOS. So we're looking at helping people to set goals, to monitor their progress, to learn how to control things that would stimulate them to overeat, to solve problems, those kinds of things. We want to reinforce positive change and try and stop people relapsing, but then supporting them when they do, because that's fairly inevitable. So very conscious of the emotional well-being. It may be that cognitive behavioural interventions may be appropriate for some people, and these can help people to engage and adhere to their lifestyle changes over the long period of time and can helpfully improve health outcomes. So behavioural intervention is going to be very important. There are a number of different ways that you could look at the dietary interventions, but what we're mostly looking at is weight reduction, decreased energy in order to try and manage weight. We know that has a strong positive influence. General healthy eating principles being followed as part of the normal recommendation. And looking at energy deficit of 30% of energy requirements or 500 to 750 kilocalories per day. That tends to be 1200 to 1500 calories a day, which is quite tight, quite difficult, and a challenge to maintain over the long period of time. We have no evidence base to say whether there is, it should be fat cutting down or carbohydrate, or whether it should be high protein. It's about what's going to matter to that individual. So we're very much about tailoring to the individual. Bear in mind that many of the women will be from Black and minority ethnic groups, so we need to consider their cultural preferences, any religious preferences for any women, and how is going to work best for them to maintain a nutritionally balanced diet, but with that reduced energy intake. So it's very much about what's going to work best for that individual. The physical activity recommendations, so the basic of that is going to be the WHO guidance. If we're looking at weight loss and prevention of weight gain, we're looking at a little bit more, but that's very similar. It's about at least 250 minutes per week of moderate intensity, or 150 minutes of vigorous intensity, or a combination of those two. Muscle strengthening and avoiding sedentary activity. SMART goals, so helping people to really decide precisely on what they're going to do when, and self-monitoring, which is a behavioural strategy which has a good evidence base. So that behavioural techniques and strategies are relevant for physical activity as much as they are for food. So what should health professionals do? Well, as much as possible, people need to be monitored regularly and supported regularly. We need to be very mindful of concerns about body image and of low self-esteem. So it's very high instance of that in this client group. And to try and, whenever possible, prevent weight gain from adolescence. Any of you who've ever struggled with your weight will know it's easier to stop it going on than it is to then lose it afterwards. So we need to start that from adolescence and get that balance of supporting adequate growth and nutrition, but at the same time not excess weight gain. One of the tools that's got a good evidence base to support women with PCOS is metformin. So there aren't many drugs out there for this particular situation, but metformin does have a good evidence base for helping to treat weight, hormonal and metabolic outcomes. So lifestyle, yes, and on top of that, metformin, particularly in those with a BMI of over 25, which is going to be many of them. So adolescence, there is a bit of variation on how people feel about that, but if there is a definite diagnosis, then it can be used in adolescence as well. Orlistat can also be used. We know that that is a medication that can be used to support obesity management in adults generally. So again, alongside lifestyle intervention with the normal recommendations for its use to the general population, orlistat may be help, as long as you're considering all the side effects and all of those kinds of things as well. And it shouldn't be used in pregnancy. So that's something to be mindful too, because many women with PCOS will be trying to get pregnant over quite a long period of time because it tends to be quite challenging. So the NICE guidance from 2018, these are the kind of things that it suggests that we really need to work on. So from a diagnostic point of view, screening for other things as well, and just checking that we've got a complete picture of the situation. It's really important that people are made aware of the long-term complications. If you bear in mind that this is something that comes on from adolescence and can therefore lead to obesity, diabetes, then potentially these ladies could have real problems at a relatively early stage of life if their condition is not managed, particularly those who have more severe versions. So we need to be encouraging a healthy lifestyle and that weight management. But from our perspective, and this is something really relevant to you if you're in a clinic with someone, is showing how weight management can make them feel better, how it can control the insulin better, how it can reduce the amount of the male hormones that are circulating, reduce the risk of diabetes and cardiovascular disease. That's quite a hard message for a teenager. You may want to talk about improving their menstrual regularity, which may be more important to them. Or in slightly older women, it might be you want to sell the weight loss and encourage it because it will increase the chances of them managing to get pregnant if that's what they want to do. So there's a lot of things to think about there about why weight management is so important. There are a number of sources of support, so I've given you a couple of links there where there's a bit more information. Royal College of Obstetricians and Gynecologists, because they are the specialism under which people with PCOS are cared for. There's some information on the NHS website, but for people living with PCOS, there are two charities here, one of which I'd mentioned already, Verity, but also PCOS Challenge. So they are places we can send people to try and make sure that they're accessing support if they've not already had that. We also have a BDA fact sheet on PCOS, which is kind of first line information for people. And that information covers 4 sections really. It talks about healthy eating and eating well, Encourages a low glycemic index diet to improve insulin sensitivity. Now notice that wasn't in the guidance, the international guidance. There is some evidence that a low GI diet can improve insulin sensitivity, but I don't think we have the evidence in PCOS specifically. It certainly can't do any harm, and it may help people to control their blood sugars quite well. Weight loss, of course, and physical activity in line with the other sources of information. So what practical advice can we give people? Some of that's quite simple. Swapping breakfast cereals like cornflakes, for example, with something that is going to be a lower GI option. So more whole grain foods. Portion size control is going to be essential if you're going to maintain that lower energy intake. And it's encouraged that people have 3 small meals a day with low energy, low GI snacks in between, to try and maintain the blood sugar levels within the range. More pulses, oats, beans, because these are low GI foods. And not to completely exclude sweet snacks, because that can lead people to crave them more, but to make sure the portions are controlled. We need to be aware that cravings are a very real problem for people. What is the cause of that? It may be because they're feeling very restricted. It might be an emotional thing. So we can't decrease carbohydrate too much, or that is likely to increase the risk of cravings and binging. So increase physical activity as much as possible. The cravings are very intense. So it's not something that someone can just easily ignore, and they can last nearly an hour. So people need to be distracted to find something to try and help them overcome that. A hot drink and a piece of fruit might distract them from that a bit and provide something, and help them to overcome the craving for something with much higher energy. Distraction therapies, again, that's a behavioral strategy. Getting people to say, am I really hungry? I don't, scale of 1 to 10, how hungry am I? And trying to separate the desire to eat from actual hunger. Am I really hungry, or is it just I want to eat something? So that's another tool that we can help people with to try and control their eating behavior. So we know about metformin can lower insulin and blood sugar levels. It's not licensed for PCOS in the UK, but it is still used. Orlistat statins might be needed if cholesterol levels are high, and people are likely to be on medication to try and control acne, to control hair growth, and they may well be on contraceptive pills to try and block the effect of the male hormones. So in summary, there is sadly no cure for PCOS. Treatment goals are based on the symptoms and prevention of long-term complications. They will include supporting people with infertility and preconception advice, reducing the risk of type 2 diabetes and cardiovascular disease, and promoting weight loss. So the treatments options are lifestyle changes, first and foremost, diet and physical activity, some medication, and behavioral changes as much as possible. I've left you some references there, places for you to have a look for more information on PCOS.